Hi, my name's Joseph Weddell. I'm a recently graduated PhD candidate, a research officer and an associate lecturer at Sydney Nursing School and the Charles Perkins Centre at the University of Sydney. And today I'd love to tell you about our most recent publication, which is titled Framework for the Development and Delivery of Digital Peer Support Programs, Qualitative Study on In-Person and Digital Delivery for People with Cardiovascular Disease, which was published recently in the Journal of Medical Internet Research. In our study, we used a multi-component qualitative study design to inform a series of recommendations for people developing digital peer support interventions. In the first component, we approached people who were attending in-person peer support, and we asked them about the perceived benefits of attending peer support and what they would recommend for future programs. In the second component, we used a digital cardiovascular disease peer support app prototype that was developed specifically for this study, and we sought the feedback of consumers and clinicians, asking them what they liked, what they would recommend improving, and the priorities for future digital peer support development. Lastly, we synthesized these two components, and we used the findings across both components to inform a framework for digital peer support development. And this framework can be used to help guide people who are developing peer support interventions in cardiovascular disease or indeed across other health conditions too. And the 6 main recommendations in terms of areas of priority of focus were uptake, flexibility, resources, autonomy, safeguarding, and easy to use simple interfaces. The benefits of peer support all stemmed from sharing their experiences of living with cardiovascular disease, which enabled coping, learning, feeling understood, and a sense of community. Well, we chose to submit our work to JMIR publications because it was a really excellent topical fit. There were several publications that we had read that were published by JMIR that were really pertinent to this study, and it just seemed like a really good place to pitch our article at. And there's a strong focus in JMIR on peer support, digital peer support, so it seemed like it was a really great opportunity, and we were really glad to put it in there. The journal also has very impressive journal rankings in impact factor, and that was one of the other reasons that we selected it, and we've had a really great experience publishing with them.